Simemeza as our guest speaker today. Dr. Simemeza is a medical doctor and he is a public health innovator, and he will be taking us through health, wellness, and innovation today. Thank you so much, Dr. Simemeza, for joining us. I will hand over the floor to you.
So my name is, just as an introduction, my name is Tinotenda Michael Simemeza. I'm a medical doctor and I work as a frontline health worker at Pora group of hospitals. And I think since I was a student, I've been involved in public innovation programs to promote health and wellness. And that's a brief background of myself. So just to start off, we just need to define the terms health and wellness. These are terms that are usually used interchangeably, but they mean different things. And so health, according to the WHO definition, is a state of complete physical and mental social well-being, not merely the absence of disease or infirmity. And wellness is the optimal state of health of individuals or groups. And just to simply define it, wellness is expressed as a positive approach to living. So the main difference between health and wellness is that health is the goal. It's the state in which you want to reach, and wellness is the active process of achieving this state. So health is that state we want to achieve, but wellness is the process by which we can achieve the state. So that's why you see wellness programs may be defined, used differently. How you can use diet to achieve health, how you can use exercise and so forth to achieve health. So that all that is the process of wellness. So innovation, I thought I would define this as well because it's applying to this topic that we're discussing today. Is the creation or development and implementation of a new product or process or service with the aim of improving the efficiency, effectiveness, or competitive advantage if you have competitors. So most of the time people define innovation in terms of technology or new technology, but in simple terms, it's just creating ways in which you can make systems more efficient and more effective. So due to the wake of COVID-19, we've seen over the past 2 years that innovation in healthcare has been spurred. It has, we would call it a boom in a sense that the way we are applying innovation in terms of healthcare nowadays has actually been speeded up because of the COVID-19 pandemic. And because of the lockdowns and because of the lack of access to healthcare systems and healthcare platforms, technology and healthcare innovation has become the forefront of healthcare as we are experiencing it right now because of the wake of COVID-19. So you can see that health tech and telemedicine have become like a rising industry. And it's actually growing exponentially due to that. Yeah. So for us, when we think about innovation and when we think about healthcare innovation, we think in the context in which we are applying it. And it's important to always, if we are in an African setting, to think how the systems work and how the systems function. So I thought I would present this as Think Africa. We should think in terms of Africa. Health funding is actually minimal in Africa, as we might all know. And there's also a lack of adequate skills. By adequate skills, we mean the skills that are attending to the patient and also the surrounding resources that are providing essentially to the wellness and the health of the patient. So we have quite a lack of it, and it has been shown that the lack is now world over because of the COVID-19 pandemic. We saw how many developed countries failed to meet the demands of the pandemic. So also the skills are not just particularly lacking in Africa, but right now they are lacking the world over. Also, some of the problems that we face in Africa are dysfunctional health insurance systems. So you will find out in Zimbabwe right now, the majority of the population is unemployed. A greater percentage, which is like 90%, is unemployed, meaning only about 10% can be able to get proper health insurance. But you find out amongst that 10% that gets the health insurance, they probably focus more on funeral policies rather than normal medical aid and health insurance. Not knowing if this is actually stems from the African background, where we put priority towards funerals rather than the health and wellness of an individual. So you see amongst that 10% that has insurance, it's mostly going towards funeral policies. And another problem that we are facing is that most of the population in our setting is in remote areas. There are poor systems, there are poor transport systems. So getting the adequate care that you need is proving to be difficult for those who are living in remote areas. And that's why the focus on health technology, health innovation is now a major priority, especially in our setting, and which is what we are pushing for. There's also a lack of adequate infrastructure. Infrastructure may mean the buildings, the physical buildings, but also infrastructure in terms of internet, in terms of electricity, that is, also supports health and wellness, and also the desired resources that we need so as to achieve the health that we are aiming for. So I decided in this presentation just to actually present some of the few examples of how we are applying innovation to the medical sphere in Zimbabwe. Me and some of my colleagues have founded a few programs that we are currently doing, that we are trying to apply technology innovation to make our systems more efficient and make sure that the end user, the patient, gets the proper treatment that they require. They get the adequate skills that are needed for whatever disease or ailment they might be facing. And these are some of the examples that I'm going to share with you. This is not a lecture, but it's essentially a discussion on how we can improve our health systems using the various resources that can be available to us, and also the technology that we have already. So the first program that we're doing is called AfriMom. And this is essentially, we're trying to improve maternal and sexual reproductive health through an antenatal care mobile app that we are currently using and onboarding. The second one is called Azanza Health. I'm gonna really break these down on our next slides, which is essentially the use of telemedicine, tele-ultrasound systems, and tele-ECG. These are essentially tools that we use to visualize the heart and make specific diagnosis depending on the patient's symptoms and so forth. So these are also aiding instruments in achieving health and wellness that we are using in Zimbabwe. Then the last one, it's a program called Vax Global, which is essentially verifying vaccine delivery through QR codes and biometrics. And I'll explain how these three technologies or these three innovation systems that we're using specifically apply to Africa and how we are improving health access in Africa. So AfriMom, this is an application we started building when we were medical students. I think we were selected as the World Health Organization top innovators in 2019 because of this application. And when we were designing it, we were looking at the need that was there, that pregnant women in our society right now do not have adequate access to information regarding on how to complete your pregnancy in a well and healthy manner and deliver a live child without complications. So we developed this application to meet that need. And we're currently improving access to maternal and reproductive healthcare through this mobile application. You can see the main features of the application: food and nutrition, what you need to achieve a nutritious diet when you're pregnant, health topics, different health topics that we discuss with the patients through the application. And most importantly is the way it says community. So I see Pora Health is sort of like doing that in the sense you're using social media to create a community to discuss different health subjects. So it's the same thing that we're using. So mothers that have access to the application can join the community using the different various platforms. WhatsApp being a major platform we are using. So we created WhatsApp groups for pregnant women such that they are moderated and we can actually discuss with the different pregnant women about the different health topics that they require so as to achieve a normal, viable pregnancy. The second project we're doing is Azanza Health. So we partnered with this American company called Butterfly IQ. I think you can see my colleague there holding a cell phone and doing a scan on a patient. So there's now new technology that we're using innovatively in Africa to say, as long as you have a mobile phone and you have that probe, we can actually do a heart scan or whatever type of ultrasound scan that is needed in providing care for patients, which can then be recorded. So you can see this guy is recording the heart over there using the mobile phone. Once the recordings are done, they are uploaded on a cloud service, which can be accessed by specialist physicians around the world. Actually, we are in partnership with cardiologists in the USA who can access these images and actually give a comment to say, this is what is happening on the heart of the patient. And then we can then treat the patient accordingly in our setting. So this is an example of an innovative way that we are using so as for patients in our setting to access the desired specialty care, the high standard specialty care, without actually the specialists being on the ground. So we've been doing this project for the past year, and it actually boomed because of COVID-19 and the lockdowns. Patients didn't have access to the proper doctors and care that needed to be done. So we've been using it over since the pandemic started, so as to improve access to tele ultrasound care and specialist services. So I had put these videos. I don't know if they're going to play when you're the director, but this is essentially an example of what kind of images we take. This is an heart image with the different 4 chambers. And you can see that on your left side, where there's a sort of like a whitening over there. That's actually a mass called an atriomyxoma, which we use to diagnose with this equipment. It would have been lovely if you could play the video, but I'm sure because you can't at the moment. But this is an example of what we saw on the ground here. Then a physician, a cardiologist that was in the USA managed to make a diagnosis, and we managed to treat the patient accordingly. You can actually, so you see that ball that is interrupting those valves. That's actually the mass, which is sort of like a benign mass in the heart of a patient, and we managed to treat the patient accordingly. Yeah. So Vaxi Global, this is a health verification system that we are currently using in Zimbabwe, which we developed. So the interesting thing about this technology that this innovation that we designed, we actually started designing it before COVID-19 pandemic, because we had seen that there was a problem in Africa, whereby when people are traveling, they require vaccination certificates or vaccination cards for the different ailments that are needed at border controls, particularly yellow fever. If you have traveled in Africa, you will realize they need a yellow fever certificate. So we actually designed a solution whereby we can digitize these certificates. The space now of digitizing this certificate is now more competitive due to COVID-19, But this is actually something that we started before the advent of COVID-19, and we've been using it and piloting it in Zimbabwe, using a mobile application that works offline, because we have to think Africa. So most of our systems, the internet is difficult to access in most of the places in Zimbabwe. So we decided to design it in a way that it's offline, and people can actually verify vaccine delivery and minimizing wastage of resources. So essentially, how we are using this innovation is to say, when the frontline workers that are giving the vaccines, let's say those that are giving the COVID-19 vaccines, they get to take, with the patient's consent, of course, the patient's facial biometrics. Then they are linked to the vaccine information to say this patient, you can see the second cellular phone over there, was given this vaccination, which was manufactured by this company, Pfizer or whatever, given, administered on this date, and then you save. Then a QR code is generated that can then be accessed at ports of entry as you're traveling, and verified by those who need verification. But just to emphasize that the power will be in the patient's hands, whether to give off the information or not, such that the patient has the autonomy over their information. So this is an innovation that we've been using, such that vaccine distribution can be monitored. We can easily trace how the vaccines are being distributed, because there are APIs that can trace where the vaccine is being given, and we can see where it's lacking in terms of our setting, to say, this region in Matabeleland hasn't really received enough vaccinations. So we can easily trace that, and we can easily provide data that can be used to improve the access to vaccines in the different spheres. So this not only pertains to COVID-19, but also the different vaccines that we've been given growing up, and that we have lost the documentation of. So the why we use biometrics is to say, in Africa, in Zimbabwe and in Africa, most people do not have smartphones. They live remotely. So let's say my grandfather in Zarabani is there, receives the vaccine, and receives that paper certificate, which can be easily lost and manipulated. And now I'm based in the United States, and I want to invite him to travel to the United States, which means if he has lost that card, he won't be able to travel. So the use of biometrics is to say he has the biometrics on him, so we can easily retrieve the information by using his facial recognition, and his data for vaccines can easily be brought about, and then he can easily travel and visit me wherever I am throughout the world. So we are trying to improve health access to everyone, even those that are in remote areas that have no access at all. So yeah, this is sort of like a video that you can play. You can you can remove the sound, but it's a video just to see how we are using this technology, this innovation in Zimbabwe. I don't know if you can play it. If you can't play it, it's fine. But yeah, it's just short, just 24 seconds, just a model for what happens. So you get your app, then the person, you actually get the facial recognition of whoever is getting the vaccine. Then information about the vaccine is then computed. And so that way you are now working with your vaccination card. Even if you lose the paper certificate, even if you lose your mobile phone, we can easily retrieve the information easily. So this is also another this is now the Sekuru's front. This is the application that the traveler will have. So my Sekuru from Zarabani, if he has the mobile application, this is what he will have. You can play the video. It's another video because I wanted to show you how we're using this practically. You can remove the sound if you can. So this is your welcome page. You log in to see your application, where the information is, and just play, it's fine. Then you enter your login details. Then you get the information. So you can see, just pause for a minute. You can see this is the face of the application, whereby you can actually authorize access. You have the autonomy to authorize the access to your documents. Then you can see there's a COVID vaccine and general vaccinations that are being given. So you can easily retrieve this information and it cannot be easily lost. Then you will, on that top corner where it says COVID vaccine QR code. So the QR code on your mobile phone can actually then be retrieved by those who would need that information, specifically those at border controls and so forth, so that access to traveling and so forth can become easier. And we can actually have proof of vaccination that is immutable, that cannot be changed, and that cannot be faked. So this is also something that we're doing. Next slide, please. So I was essentially trying to explain how in Africa, you have to think about the different confounding factors that affect your innovation, like what I described, internet access, and so forth. So that's why we developed an offline mobile system with Vaxi Global, that we can then sync the data when we have internet access. So when the frontline health workers are giving out their vaccines, they are storing the information on an offline application that can then be synced when internet access is available. So this is something to think about. So whenever we are applying innovation towards achieving health and wellness, we should think different. We should think in our context in terms of the African setup. You will see that most of the technologies that are being produced nowadays do not take into consideration those different confounding factors I was talking about in terms of internet access, in terms of remote villages, in terms of how the general population, they might have cell phones, but they also might not have smartphones. So the access to the different social media platforms is not really easy. So also telemedicine does work, especially in our setting where we lack resources, we lack the professional acumen to attend to the different needs of the patients. So the use of telemedicine is something that can help us give our population the skills that are the best in the world, so that they can be able to receive proper care and treatment when it comes to their health and to their wellness. So I think with that, I conclude this discussion, and I hope you caught a few nuggets of how innovation can be applied to health and wellness, and how we can easily achieve first world healthcare in our setting right now in this present moment in time that we are living. I don't know if there are any questions or any discussion points that people might want to add.
Thank you so much, Dr. Simemeza, for that insightful presentation. And I had opened the floor earlier on for questions in the chat box, but please feel free to ask any questions. If you would prefer to unmute your mic, if you would prefer to add on to the discussion, please feel free. Or you could just drop the questions in the chat box. And so I think I have a question, and I would go first. So you mentioned how, I think it's for the Vaxi Global Initiative, where providers used biometrics or to ensure that, people give their consent, or people are for identification, right?
Mm-hmm.
And so I wanted to ask that, did you face any challenges, or how best did you get people to feel comfortable, or that their information was going to be safe and secure? I understand some people would maybe hold back to say, how are you going to use my information and things like that. So how best were people made to understand that their information was to be, secure with Vaccine Global?
Okay, I think first and foremost, it's important. I think in medicine, whatever you do, you need to have the patient's consent, whether you want to treat them, you want to administer treatment, and so forth. And you have to make sure you have explained thoroughly in whatever local language or whatever way that someone can understand what is needed. So the problem that was there was to say, if we just give you these paper certificates, they can be easily lost. And once they are lost, we have no way of actually knowing or retrieving the information. So essentially, to add biometric, you will see our solution is probably the only one with biometrics, in the sense that it applies to our setting where most things are paper-based. So what we do is we do sort of like an educational run first before we start to enroll people. We teach them what we're doing. We told them what we're doing. And once they understand what we're doing, and they ask the different questions on to say, this is your information, you have autonomy over it. You can allow anyone to access. If you don't want someone to access it, it's up to you. That's why we added those features on there. And most of the people tend to then understand how it's going. And this is where the world is going. So we need to be part of the global village. So the resistance sometimes is there, especially when people don't understand, and the conspiracy theories that always come up, especially pertaining to vaccines, vaccine hesitancy. So what we're trying to do is make sure we educate people before we just take their information.
Yeah, thank you very much, Dr. Simemeza. I'll ask Chonjerai to ask your question.
I just wanted to ask about, you mentioned that you're trying to find ways to make it, for example, Azana Health. You mentioned that you're trying to find ways to make it accessible for everyone. So what are some of the ways that you're doing this? How are you trying to make these technologies accessible to everyone, whether it's those in the rural areas or anywhere else? What are some of the initiatives that you have taken towards that?
So what we did with this project, we actually approached the Ministry of Health in Zimbabwe to say, we have a proposal to say we want to get that probe that you saw that was connected to the phone, such that every doctor who's working in the district hospitals in Zimbabwe, in the 10 provinces of Zimbabwe, can have it. And then we have a central command center to say that is centrally in Harare, where the specialists that are in Harare can get the information that would have been uploaded from the different districts and then comment on it. And then the doctors can have the information that they need so as to continue treatment. So that's what we're actually trying to do now, to get those probes and those cell phones and iPads to all the doctors in the districts, such that they can be able to do the work. So we are also planning a training program as well. And we want to approach the telecoms because we know sometimes internet access to then upload the information is difficult in the different districts. So we have approached international organizations in terms of satellite systems that can be able to help us to access internet remotely such that it can be easier for our users on the ground. So that's what we are currently doing, empowering the district doctors such that they are able to use the machine. And then centrally in the capital city, we can have the specialists that can then give out the different diagnoses and information that the general practitioners in the district need to operate.
Thank you very much, Dr. Simemeza. I hope, Tunderai, you answered. I'll move on to Wadzi. You can ask your question, Wadzi.
Thank you. Thank you, Dr. Simemeza, for such an insightful talk. I was really interested at the beginning when you mentioned the health insurance structures in Zimbabwe. And my question is really about what some of the determinants of the dysfunction you presented are. Like, is it a matter of health policies being inaccessible versus like funeral policies? I guess maybe my question is more so rooted in the fact that I've seen that funeral policy companies are more active when it comes to like advertising their policies, signing people on, and I've never really seen the same energy or the same effort coming from health policies. So I was wondering what your take on that is.
I think the funeral policy agencies that are in them have studied their market in a sense, which I haven't seen much from the health insurance policy people. So you see people in our setting, in our context, really fear death, and they also really fear what will happen after they die. So usually they then create, they are more inclined towards paying for their funeral policies rather than their health policies. And I think it's due to a lack of information and also a lack of trust in the already existing health insurance companies, in a sense that we've seen that health insurance companies currently, it's a really corrupt industry, and sometimes patients do not get the benefits of which they are paying for every month. So which means that discrepancy in the information and in the trust is not there. So which means patients would rather pay funeral policies that they are seeing that they are burying their people and people are being given a good send off, rather than health policy, the health insurances whereby they go to the hospital and their health insurance is denied, in which they are paying every month. So I think it's that trust and also that lack of knowing how our people are functioning and how we can actually be of benefit to them.
That makes sense. Thank you.
Yeah, so Dr. Simemeza, I have one question for you. So I think one of the limitations of blockchain technology is scalability issue. So when more people join like the nodes, the network like it slows down. How are you planning to address that issue?
So with the blockchain, because it's new technology, for us, we're using a distributed ledger in a sense. It's still the same type of technology whereby, so I'm not really a tech guy, but I interact a lot with people who, and part of my team who are tech people. So we're using what we call the QLDB, distributed ledger. That's what we are using. And when more numbers then come in, I think we are actually working with engineers from the USA, so as to develop our system so that it can accommodate more numbers, using also the AWS system from Amazon. I think you know it, which we are also applying to the technology. So it's a hurdle that is there, but it can be managed using the different systems that we're using.
Yeah, thank you very much. Anyone else who has a question before I hand over to Tunderai? Or if no one has a question, Tunderai, you can give us the closing remarks.
All right. I just want to thank you so much, Dr. Simemeza, for the insightful presentation. I believe that we all learned a lot from it, and it's great to know that in Zimbabwe, there's people working towards technologies like these that are meant to improve the health system in Zimbabwe. And I believe once it's all in action, it's going to help out a lot of people in Zimbabwe. And I would also like to thank everyone that joined us today. Thank you so much for your time. And yeah, I hope you all have a great day. And we look forward to seeing you as we go on with the speaker series. Thank you so much.
All right. Thank you very much. I greatly appreciate it. I greatly appreciate the work that Pora Health is doing. I think it's a much needed platform so that people can get to know about health and wellness and how, because of there's so much misinformation out there that needs to be countered. So thank you very much for the work you guys are doing. It's an incredible platform.